Hi, my name is Jake. I'm a volunteer. Is it all right if I come on in? I love music. I've always loved the idea that music can be connected to memories, and I love the experience of listening to a song that takes me back to a certain time and place. And that's kind of the beauty of this program, is that we can facilitate that same experience for patients.
Oh yeah. Welcome back.
And then, as a volunteer, I can sit down and listen to patients talk about the story that's associated with that song or the relationships that are associated with that song.
Back in the 80s, going on this long Boy Scout trip, it was the most beautiful view over the Teton Mountains you'll ever see.
Ultimately, the goal of the program is to address patient anxiety, patient loneliness, to improve patient experiences. Along with the therapeutic benefits of the music, there's also this therapeutic benefit of this human conversation that the volunteers can facilitate with patients. We provide every opportunity for patients to reclaim some sense of control over their space. When I knock on a patient's door, I introduce myself from the doorway, but I'm very intentional on not crossing the threshold into the room. I'm trying to respect their sense of autonomy. When a patient spends an extended period of time in the hospital, especially those that don't have any visitors, the only interactions that they have are in the context of them as a sick person. And so what we can do is we can walk into a patient's room and ask them about music they love, share it with them, listen to the stories that are associated with it, and help them tap into parts that may have remained dormant during their time in the hospital. I really like it when a person that aspires to work in healthcare becomes a Healing Beats volunteer, because I know for me, I've gained a lot of perspective about the patient experience regarding navigating the complex healthcare system, the stresses of receiving a diagnosis or going through treatment, and that's going to help me when I start working as a nurse guide my practice for patients. To be a Healing Beats volunteer, you need no healthcare experience or any music experience. The only prerequisite is just a desire to connect with patients and improve their experiences. When somebody starts listening to a song that they love, I might see their whole body relax, or I might see their foot starting to tap underneath the blanket. They might start singing and dancing, or they might start crying when you play a song for somebody that they may have not heard in 15 years. They think about memories that they haven't thought about in 15 years, talk about people in their lives that they haven't thought about in a long time. And the stories that I get to hear are really intimate.
It's joyful, it's relaxing, it kind of gives you a couple of minutes of taking you out of the space you're in, just sit back and enjoy, close your eyes, and it's a wonderful program.